Hello and welcome to the 2025 Advocacy Video Series presented by the Nevada Minority Health and Equity Coalition. My name is Alicia Love, and I am a graduate level student intern at the MSW program at UNR. This series is intended to bring light to the impacts of recent changes and challenges in the public health and social services space, as well as getting to the heart of why we continue to serve those in need to inspire hope in the community as we resiliently navigate these changes and challenges. Today we have with us Erin Rook, a writer, educator, and researcher focused on the LGBTQIA health equity. Erin is a former journalist, DEI consultant, and co founder of Gender Hive, an organization that works to improve healthcare access and outcomes for trans and non binary people in Central Oregon. He is currently pursuing his PhD in public health at UNLV, where he works with the Rainbows of Aging Lab to support research on aging, brain health, and caregiving among LGBTQIA older adults. Welcome, Erin. I am super excited to speak with you today.
Thanks so
Can
much.
you begin by introducing yourself and telling us your story? What got you into this line of work?
Yeah, so as you said, my name's Erin. I use he, him, and they, them pronouns. And I really kind of stumbled into public health work. I think, like a lot of people, I used to think public health was just about, preventing the spread of infectious disease, making sure that people got their immunizations, responding maybe to health-related impacts of, natural disasters, things like that. I didn't know kind of the broad scope of what it covered. And over the course of kind of my life and my career, I've always been really interested in and in finding ways to help people and kind of solving challenging problems, right? I enjoy kind of creative problem solving, trying to figure out solutions to things that are difficult. And I started out in journalism, right? From high school really through my undergrad, I was really interested in journalism. I edited my high school and college newspapers. I really saw that as a way to kind of shine a light on topics and issues and stories that weren't getting the attention that they needed, right? And to make sure that we were getting accurate information about issues that matter. And so I started out my career working a lot actually in LGBTQ media. So this was back um, in the early 2000s, I guess you'll say, beginning of this millennia, where we still had print publications in the LGBTQ community. So usually monthly or biweekly kind of newspapers, things like that. But so doing that work, really got to hear a lot of different people's stories, right? So one of the things that was really impactful for me about that experience was hearing people share things about their lives, about the struggles that they'd gone through in really open and vulnerable ways, and then really made me feel like, I think, a sense of commitment to do something with those stories, right? Obviously sharing them is one thing, but there are other ways that we can kind of try to create positive change from those stories. And so eventually in the course of working in journalism, I also worked in like alternative media, covering things just kind of like local news, things like that. Um, but it got to a place where I was just feeling really like I wanted to be more involved in the issues that I cared about. So I was volunteering for a domestic violence agency, and they had a position open up. And so I kind of shifted out of journalism at that point to be able to tap into something that I was really passionate about, right? Personally, I'm a survivor of intimate partner violence, and I know how important it is to raise awareness about that issue, right? And in particular about how that impacts members of the LGBTQ community. There's not as much knowledge and understanding about that piece and support services. So that kind of got me, into this more, I guess, kind of explicitly social justice type vein, I guess you could say, or health equity related vein. But again, I still didn't really know what public health was. And um, from there, I went and worked in a university for a while doing diversity, equity, and inclusion work, and also some health-related work. I also worked on a grant from SAMHSA, the Substance Abuse and Mental Health Administration, working on suicide prevention work in the university. And so, again, really, I think to me, all these things have always been really connected. How do you help people? How do you work against injustice? And I think there's a lot of different avenues for that. But ultimately, where it led to was a lot of work trying to create change in the community I was living in related to transgender health, right? So I'm someone who I will always let someone know if I think there's something wrong, if something's going on that doesn't seem like it should be, or if there's an issue. Like I'm not a complainer, but I will, give feedback and offer to help make the thing better, right? And so when I was living in Central Oregon, which is a community, I would say in many ways similar to like Northern Nevada, a lot of rural, but kind of one larger town there in the middle. I found in my experience as a transgender person, it was really hard to access healthcare in that community. There wasn't a lot of awareness. There wasn't, really anywhere you could go to figure out which providers were going to be safe or friendly or affirming or anything like that. And so, I was starting to kind of advocate in the context I was in and thought, if I'm going to be essentially educating my own provider, why not educate more than one provider? Might as well make good use of the time, right? And so, together with a friend who is a parent of two transgender children, we started doing more and more advocacy in the community, and eventually, got to a point where we were training, hundreds of healthcare providers across the three-county area, just in the basics, the foundations of, how to provide care in a way that is respectful and affirming and appropriate, and where to go to find, the information you need. And bit by bit, kind of that grassroots advocacy and education, grew. And I worked with some friends. We founded a DEI consulting company called Allyship in Action to do some work in that space, and then ultimately co-founded something called Gender Hive, which is a community-based organization in Central Oregon that's really focused explicitly on trans health advocacy, education, resource navigation, things like that. And it was really cool to see that, when we brought people together from across different sectors, um, there was energy to make these things happen. So, and this is a really long way of answering your question, but essentially, my passion for helping create positive change in the communities that I'm parts of, led me into this space. And so when I moved to Nevada, I reached out to Dr. Flatt, who is now my advisor and mentor, just really to connect and see, are there opportunities in Nevada to do work similar to what I was doing in Oregon, right? Because, I think in Nevada, there's a need for more awareness and access and education. And, just through those conversations, kind of realized that I could go back to school and I could do some of these things that I didn't realize were an option. I think what really drove me to do that, to move into the kind of the research space, is that I'd been doing a little bit of community needs assessment and things in community, and I recognized how important and impactful that was, but I also didn't have any of those skills, right? I might have had some aptitude or some like transferable skills maybe from journalism, but I'd never taken a research methods class. I'd never taken a statistics class, and I just really wanted to have the tools to do that work. I think there's a real still gap or a lack of people from impacted communities doing research about the issues that their communities face. And even the most well-intended researcher who doesn't have that lived experience, there's always going to be a bit of a gap, right? Even no matter how much you might educate yourself, right? Like I'm never going to understand what it's like to be, an immigrant to this country, right? I'm never going to understand what it is to be someone like, yeah, so many different experiences, right? We only know what we've experienced. And so I think getting more of that foundational knowledge was just really important to me. Uh, and I will say it's felt like just like the right place, right? Sometimes you start on a path and it just feels like, yeah, things start to click. But that's a little bit, I guess, of how I kind of got into to where I'm at right now. But
Your story is incredible, and I definitely agree that you have you are on the right path. It shows in the way that you speak, your passion comes through in all the words that you're saying and all the work that you're doing.
thank you, I appreciate that.
Can you tell me about some of the work that you're actually doing right now?
Yeah, absolutely. So obviously homework, but that's not the part you're most interested in, right? So in addition to working on my PhD, I'm working as a research assistant, have for the past couple of years, with the Rainbows of Aging Lab at UNLV School of Public Health. So that's with Dr. Flatt. And we really focus on research related to healthy aging, brain health, things like dementia, Alzheimer's, Parkinson's, as well as the experiences of caregivers who are caring for people with those kinds of conditions. And so we've had some really interesting projects that we've been able to work on. A lot of it involves, things like survey development and interviews. Um, but what I've really enjoyed is, getting to really get hands-on in doing that work and a real variety. Um, it's important work to me, not just because I care about, the LGBTQ community and their health broadly, but on a personal level, I come from a family with a really strong history of Alzheimer's and dementia. My paternal grandmother was one of 12, and a significant number of her siblings, including herself, passed from dementia if they were, lived long enough to get dementia. There's a really that strong piece to the point where in our family we kind of maybe somewhat darkly joke and assume that we're all just going to get it, right? It's just we just have accepted that as like as fact for better or worse. And so, um, being able to be part of research that's, looking at the, maybe unique risk factors and or protective factors for LGBTQ folks when it comes to dementia, as well as looking at the caregiving piece, it's something I may not have thought about quite as much before coming here, but really, again, with that kind of assumption that, oh yeah, my dad will probably get Alzheimer's or dementia of some sort. We just kind of, assume that, I'm the oldest child. Like, I imagine that if it comes to that point, right, I would be involved in caregiving, and we know that, caregivers who are LGBTQ have very different experiences, right? But there's not a lot of research about that, and so it's been really interesting. Part of what I've been able to do is participate in doing interviews with folks who are caregivers, really getting to sit and hear their experiences and what their needs are, what unmet pieces are there. The one thing that has really stood out to me, we're obviously not, we're still working on it. I'm sure we'll be learning a lot more things, but one thing that's stood out so far about some of those interviews is the way in which a lot of caregivers kind of, if not completely go back into the closet, so to speak, like really kind of try to minimize their LGBTQ identity out of concern that it's going to impact the care that their loved one receives, right? And that's something I don't think we consider normally when we're thinking about the kind of support that caregivers need. So one of the other projects that I'm working on with the lab is helping to adapt a caregiving training tool. So that's called Savvy Caregiver. It's evidence-based in general, it works well, but to have a version of that makes sense for LGBTQ people. Um, it's something I'm particularly interested in part because of some of my past experiences, right? I mentioned I'm a survivor of intimate partner violence, and I participated in support groups, that were, it was many years ago, right? But it was meant for LGBTQ individuals, so it was kind of at the time rare in that sense. But all the materials they had were all standard materials. I mean, the facilitator did what they could. They would scratch out words and write things over the top of it, to try and make it make more sense. But um, it really makes a difference if the resources we're giving people are actually, you know, tailored to their life experiences, and you're not like feeling like it was an afterthought that, oh, okay, let's scratch out that part, make the pronouns or whatever makes sense there. So I've been working on that, and that involves two things like outreach in the community, which is great, getting to connect more with folks, getting to talk about why these issues are so important. And then I've also been working on a little bit of my own research, which really is focused on the relationship between transgender community connectedness, so kind of that connection that trans folks have with other people who are a part of the same community, right? This idea of community connectedness is something that exists in a lot of communities, even if we don't describe it that way, right? Again, I think similarly, folks who have survived intimate partner violence, right? Identifying as survivors and connecting with other survivors can be really powerful. So looking at that and its relationship to suicidality, so things like suicidal ideation attempts, things of that nature. And then this kind of connects to things, something I think you want to talk about a little bit today too, is the relationship with hope. Uh, because we know from suicide research in general that that hopelessness can be a significant contributing factor. But I think what we don't talk enough about is how hopeless this is. It can be just a trait a person has, right? You can be just kind of generally pessimistic, like tend to filter things that are happening through kind of that more negative lens, but there can also be really legitimate reasons that people feel hopeless, right? Um, your expectations of what the future might hold are really shaped by the world that you live in and what the real limitations and barriers are. And so interested in better, kind of getting into that a little better and hopefully ultimately finding ways to support communities that aren't necessarily reliant on institutions um, that may have shifting perspectives, providing support, but really drawing on, what strengths do we have within ourselves and our communities that we could foster, um, to be protective for people. And so that's kind of, I would say, the bulk, is kind of that the LGBTQ health related research, but really with that interest on what are the factors, not just these kind of like biological factors that we think of when we think conventionally about health, or like, making sure everyone can get access to therapy, which is also important, right? Mental health care. But what are like these community level factors that maybe we could all contribute to in some way improving?
It's so incredible everything that you're doing. I'm very impressed. Uh,
Yes.
do you work with the center? I interviewed Leanna Ramirez last week about the opening of her new community healthcare clinic, and we were talking a lot about the entire floor dedicated to behavioral health, providing therapy for members of the LGBTQIA plus community. But do you know her? Do you work with her?
Yeah, so we're both on the work group for the coalition, the LGBTQ work group, and so yeah, definitely we through the lab will participate in events at the center, and then the other piece that I'm really interested in with the center is they do offer like support groups or affinity groups, and I think that's a space where some of the dynamics I'm interested in are taking place, right?
Yeah.
I recently started participating in one of the groups there, and it's been really interesting. Um, just to see, yeah, how that unfolds. And I think one thing I've always been really interested in is, well, especially since, starting in public health and learning, kind of how those things go and how a lot of the interventions and things that are tested, um, in a research context, they're often developed by researchers, right? And communities may be doing things, but they don't have researchers there, they don't have funding there, no one's studying what they're doing, right? So we don't necessarily have, you can't call them evidence-based because the research hasn't been done, but it doesn't mean that they're not impactful. And so I'm, really curious about this gap that we see because I think every community I've ever lived in, no matter the size, if it was a big community or a really small rural community, if anything existed, it was a peer support group for trans people, right? And not necessarily through any official means. Often it was someone in the community. There's usually it starts as like a little Facebook group, right? Where it's like, okay, you live in this place and you're a trans person, find the group, you find some people, someone volunteers to, reserve a room in the library, people meet up, right? Very informal. And we know that, support groups are a thing that are used in other contexts and as a more formal health intervention, right? We think about like peer support specialists in like a addiction recovery context. And so, I'm not saying every peer support group that exists out there is like, you know, wildly effective or doing, doing things even in the same way, but it seems like an untapped area to look into and explore because I think there's so much potential there, right? It's not just the, connecting to other humans, right? Which we know science tells us broadly is good for you to be to connected to other humans, but something that I've heard come up a lot when talking to community members and in like open-ended responses to the survey that I have out there is how common it is for people to feel until they connect with community like they're the only person who's ever had their experience. And you would think that with transgender topics and issues being a lot more visible than they used to be, that wouldn't be the case, but it still really is until because it's not something that you necessarily walk around and you can tell you're around if you're around other trans people, right? So even if, I mean, you could be in a room and everyone could be a trans person, but if you didn't know that, you could think you were the only trans person in the room, right? It's a funny thing in that way. And so, almost so many people have talked about having that experience of feeling so painfully and uniquely alone until they had that connection with community. And so think about that piece and just the, the I think we all can relate to this maybe on some level of like what it's like to be with one of those friends who just knows you so well. Like you don't have to explain the backstory to everything. You can, you know, and it doesn't mean you have to even talk about that thing that you have in common, right? Maybe you just know it's there in the background. Um, but it's just a different kind of connection with a person. And then I think too, there's this issue, and I think this is true when it comes to, again, right, like groups like at the center, where that can be an entry point for so many people into accessing resources, right? When I first moved to Central Oregon, which is again kind of a more rural dominant kind of community, I would say, like that's how you found a healthcare provider. You searched on Facebook, you found the group, you asked who was good, and they gave you a list of like 3 people, and maybe one of them was taking new patients, and then you took it from there, right? So I think, there's real potential for those kinds of groups to help connect people in ways that are really important. And I was talking to someone in the community the other day, and they were talking about, how they got connected to community. And I asked if there hadn't been a place like the center in Las Vegas, when you were going through hard times, like what would you have done? And they thought about it for a minute, and they're like, yeah, I really don't know. Right. And that's part of what gets me really curious about this is, the community that I moved from, we didn't have a center, right? It wasn't big enough to have those kind of resources or spaces. Um, and when we did a community needs assessment of trans folks in that community a couple years ago, you know, like maybe a third of the folks we talked to didn't have a single trans friend, right? And so I'm just thinking, gosh, if you don't, there's not a center to go to, there's no obvious hub for resources, and you don't even know a single other person as a starting point, right? Like I think it just makes the community piece so important, and it makes the visibility piece really complicated too, right?
So, the work you are doing is incredibly important for communities that are directly impacted by recent changes to the public health landscape. Can you tell me about some of the impacts that you're seeing and any impacts you anticipate going forward?
Yeah, so obviously there's a lot that's been changing that impacts how this kind of work happens in both, I think, direct and indirect ways. So, one way, kind of in the big picture, is on the funding landscape, right? I know our team, the Rainbows of Aging team, experienced initially having some grants, some funding totally revoked, right, that had already been awarded, or had been, you could have announced that we were receiving it but not yet sent, and things like that. And in those initial rejections, it was really framed as being because our work involved transgender people, and the idea was that the official stance of the government at this point was that trans people basically don't exist, or that to talk about gender identity is to somehow promote something that is factually incorrect or not scientifically founded, or that it meant that the rigor of our research was less in some way, which is wild because Dr. Flat often is one of the top scoring. When you submit these grants for review, like always gets really high feedback, right? Because they're well done. And so that definitely created some uncertainty for our team. And our team is smaller today as a result. Dr. Flat's done, I think, a remarkable job trying to pull together other resources and to reapply for some things or adapt applications to try and get things funded or refunded. But it's definitely made it challenging, and also not knowing what the future holds, right? Like, will we be able to keep this grant? Will this one go away? Is there going to be an issue with how we talk about the work we do, right? Because, it's hard to research the health of LGBTQ populations if you can't use the words to describe them or to frame a question that allows you to capture that information. And so that's definitely been a challenge on a practical level. And then, certainly on, I think, just kind of like a psychological level, right? But I appreciate that, you know, Dr. Flat's really just committed to the work and figuring out ways to move forward. So that's been good. But I think beyond that kind of research impact, that's like kind of a small but important piece of the puzzle, right? I think we're seeing real impacts in access to care, right? Depending on where people live. There may be state or federal policies that are impacting their access to care. There's also, because there's so much fear and uncertainty, we are seeing healthcare organizations change their offerings before they're necessarily like mandated to, right? Just because they're anticipating that they're weighing the pros and cons and thinking, well, maybe this will be the better choice in the long run. So like I know a provider locally who was told she could no longer, or that they could no longer provide hormones through the place that they were providing care because of concerns about funding. So that's been tricky. There's obviously the climate in general is not good for people's mental health. And that's tricky. We already knew before things were kind of shifting even more, that just being aware of anti-transgender legislation can have a negative impact on mental health. Dr. Farr, one of the faculty in our School of Public Health, did some research about and showing that awareness of the policies or efforts to ban athletic participation for transgender folks, even if you were not yourself trans or didn't live in a state where that was applicable, it was associated with an increased risk of suicidal ideation. So we think about that. And then the current climate, right? There's, again, a lot of uncertainty. People are trying to navigate passport situations, if they are going to be able to renew those or apply for them and get accurate documentation. Um, I think there's just a lot of concern about what's happening next. And I think, unfortunately, we're seeing also like a real rise in misinformation and disinformation about transgender people. And that's something that I've been, I guess, kind of on the side, been trying to work on a little bit, is thinking about, how do we address that? Because I think, it's not the first time we've seen misinformation about health related topics, right? Obviously, COVID was a time of quite a lot of misinformation. But I think in other contexts, it feels like it hasn't been so imbalanced in terms of the quantity of misinformation relative to accurate information, right? You still have to sort through it, and depending on like where you get your information from or your social circles, it might be shifted one direction or the other, but it feels right now like that most of the information that's out there and easily accessible to people about transgender people is not accurate. And then that's what gets kind of spread, because it's been, kind of latched onto and politicized in an effort to kind of galvanize support by some folks. It just really, catches fire quickly. And then, especially in our current, like social media landscape in particular, I think everyone's rigor to the extent any of us were rigorous about how we decided whether or not to share things on social media. Like, I think that's really slipped across the board, right? So I'm not saying any particular group of people, but I think we're all more likely to click that little share button before we've actually checked, like, does this even say where the info came from? Can I go look it up and see if it actually really happened? Is this coming from a reliable source? All of that. Um, and so that's, kind of, I think, embolden some folks who might be already inclined to be unkind or discriminatory, and it just creates a lot more confusion in it. I even in I've been working on a survey to try and learn more about what folks know and what they don't know, and it's been interesting to see some comments coming through about there's a sense that there's a lack of um, consensus around standards of care, particularly for transgender youth. But then at the same time, folks, indicating that they're not familiar with the international organization that sets standards of care, right? And so there's a disconnect, right? And there's I think, a narrative that's trying to make things seem less settled than they are, but it's hard. Reading through, the open-ended responses to my survey that I started for my thesis, right? Asking questions about suicidality and community and things like that. There's just, you can see the impact. It just happened. It wasn't my plan initially, but it just happened that you know, opened the survey on January 20th, right, which was Inauguration Day. It's also the day that one of the first executive orders related to gender identity was released. And so I feel like you can really see the impact of the changing political landscape. There's a lot of folks, expressing some dark thoughts and dark experiences. And that's, again, kind of going back to that hope thing, right? Where I can't blame people for feeling a little hopeless, rather, if they're seeing the avenues and pathways to where they're trying to go and how they're trying to live their lives kind of being blocked in different directions. So I think that's been hard. I think the other thing too is it's made people less inclined to be visible and open, right? People are talking about whether or not they should be leaving the country. Like, not to get all doom and gloom about it, right? But I think sometimes we don't know how people's day-to-day lives are being impacted unless we have those conversations, right? Similarly, I was talking with some international students recently, and even though I like to think I'm empathetic and aware to a certain extent, right, of what folks are going through, they still share things like that I might not have thought about in terms of like just every single day, like what about their daily routines is different now because of the fears they have, the uncertainties. So, um, there are folks who aren't even putting their pronouns on things, who are definitely not letting people know that they're trans or non-binary. Um, and that's totally understandable. And it also makes it harder for us to find each other, right? To even know what resources are there, to know who we can turn to or talk to. And so, um, I've been trying to, like everyone else, to navigate that and figure out like what are the ways that feel um, like a worthwhile risk, whatever that means, right? Like where it feels like you're not putting yourself to the extent you can know in too much harm's way, but it's hard, right? Even little things like you think, okay, maybe I want to wear something today that signifies to other people that I have that identity. But that's a hard thing to, it's one thing you just don't know who you're going to encounter, right? You don't know how people are going to respond. And it could be it could range from absolutely nothing, right? You could get no comments, no, it could be just fine, to something really bad, right? Or anywhere in between. So it makes it tricky, right? To build community and sustain community when people don't feel safe letting others know that they're out there, right?
So, bringing it back to hope and staying hopeful, what are you doing and what do you see that people around you doing in order to stay hopeful? Do you have any advice to give your fellow advocates who might be facing similar challenges and emotions?
Yeah, that's a great question, and it's so hard. And when I've been asking people lately as well, like, where does hope come from, and how do you maintain that? Even if you were someone who baseline was optimistic, right? I'm someone who people I would have been described, my whole life, right? Like optimistic, idealistic, maybe, to like uh, even rose-colored glasses. Like I always I tend to see the best in people, maybe for too long sometimes, right? Um, but I definitely don't feel as hopeful as maybe, I have in the past. I think some things that I find helpful or that others have suggested that I think make sense. Um, one is, and I'm really bad at this, but creating some healthy boundaries around our what we take in, right? Whether that's the news, whether that's just who we're around, the context we put ourselves in. And it's a hard balance, right? Because we need to know what's going on, right? We need to be safe, we need to be aware. Um, but obviously taking that in over and over, it wears on you. I've found now there are a couple of folks out there that are intentionally compiling positive news. So and this is a UNLV, someone has a fellowship at UNLV right now, but they have a Substack called Trans News That Doesn't Suck. And so they just compile positive news. Not that they don't know that there's bad news, they're aware that there's bad news out there, but and there's other accounts similar to that. So I think focusing on positive where positive exists, right? Celebrating little wins, right? Things that are going well. Someone else I talked to just talked about how really they just focus on trusting that they can make things happen for themselves, right? Like, really this idea of focusing on what you can control or what's within your own, sphere of influence, if you will. And the person I was talking to was just like, yeah, I just, just don't give up, right? They're like, if there's not a door, there's a window or a vent or like you're trapped there, there's might be hard and you're gonna have to, you might have to crack a hole in the floor, like, but if you just keep pushing, you can eventually find a way out. Of course, that pushing is also really taxing. So, ideally people shouldn't have to do all of that, but so just kind of this idea of, yeah, I guess focusing on like, what can I do, to try and feel like I'm having impact where I can, trying to hold on to the positive things. And I think also just trying to remember that like we can hold more than one feeling or experience, right? So like trying, even though it might feel a little hopeless sometimes, doesn't mean it has to steal all of my joy, right? And that you're allowed to feel joyful even when things are hard. Because I think that can be tough sometimes if you're someone who feels a sense of responsibility or a lot of caring about what happens, like feeling like you should just be pouring all of your energy into addressing the crisis at hand, right? But we have to be able to have that joy too. And I think the community piece feels huge to me too, right? Just having, because the more alone we are, and and even if it's just because we're not really socializing or we're not connecting with the people in our lives, like I don't know, it's easier to feel hopeful, I think, when we see that we're not alone and that we're part of a community with other people. But yeah, it's not always easy to do. And I guess the other thing that I think about, and maybe this kind of goes back to the journalist in me, but is thinking about like how do we make meaning out of these things that we're experiencing. Um, and I think that's, it also connects back to just on some level to that kind of dispositional hope, right? Where it's like, well, how do you filter? What's the framework you're building around the information that's coming in for you? Because obviously you can interpret the same thing multiple ways. It could be like, oh, that's just a thing that happened, or like, oh, this person or this institution is personally attacking me. Um, and I think having community and having that broader context makes it easier to create a narrative that isn't like hopeless, like ultimately hopeless. It doesn't mean that you're washing over or painting over the bad, right? But you can understand it in a way um, that you can make sense of. Because I think I can't remember the exact context, but I was reading something about how some of the distress in that comes from the gap between your expectations and your reality, right? So you're like, oh, it was supposed to be like this, but it's not. And so if you can't find a way to make sense of the difference between what you thought was going to happen and what really is happening, that's hard, right?
I wanted to thank you so, so genuinely for showing up and doing this interview today, Erin. And for those of you watching, thank you so much for taking the time to watch these advocacy videos. We'll be posting more, so please check those out on our YouTube channel. And yeah, thank you so much, Erin.